Welcome back. I've got Nicole Johnson on. Nicole, how are you today?
I'm good. I'm well. And how are you?
I'm doing really well. Looking forward to this one, and thanks so much for making the time to be on the show today. So, why don't you share a little bit about you, and then we're going to jump into the conversation.
Thank you so much for having me. Well, let's see. Where do I begin? I am a nurse. That's probably the easiest place to start. I've been a nurse for a long time, mostly critical care, and I loved my job. Got to a place where I was in a leadership position and essentially burnt out. Um, and wanted to leave the leadership position to start something for nurses. So I ended up starting a business called Unwound Retreats, where I offer events, resources, and retreats for nurses because the job, as we know, is inherently stressful. So, and this wasn't being offered anywhere, and I figured I might as well try. So, I now currently offer international retreats in a few locations. I do quarterly events. And I'm just trying to beat the drum of like self-care is really important and also that hospitals should be doing way more for their nurses if you're listening. So yeah, I'll stop there.
Having worked in primary care and had my own burnout journey as a healthcare executive, I can kind of relate to what we're seeing. And yes, the nursing role in particular is one that is one of the most challenging roles on the planet. And then, if like in your situation, critical care, the key word there, folks, is critical. It's
Hmm.
not like I'm coming in for my flu shot or, I want to check on this. No, this is in many cases, we're teetering on the life or death situation here with every patient you encounter. And
Hmm.
there's a nonstop flow of people that find themselves in that situation. So it is a very taxing and stressful role. And even, the best of people that can, harmonize, they take good care of themselves, they get good rest, they are active, they do everything they can. It burnout will kick you. It doesn't matter. Burnout, it does not bias against anybody. It goes after anybody and everybody. And I agree with you. The healthcare system, ironically, is there to help people get better. And they don't necessarily have the systems in place that can help the people get better. We're so
Hmm.
focused on the patients, which makes sense. But if we don't take care of ourselves, who's going to take care of the patients? And we see that. We saw it during the pandemic when there was mass exodus of people leaving the healthcare system, nurses in particular. I know there were countless stories where I would see something online where, a nurse that went through all the education, the schooling, establishing their career, starting to rise through the ranks and all of that, and decided, you know what, screw this. I'm going to go be a cashier at Target. Now, I'm not knocking being a cashier or working for Target or any other organization, but when I look at it from okay, we just lost talent in our sector, and it's really hard to get people to get into the sector because it's well documented on how challenging it is. So obviously had the situation. You were, in leadership role, which is what, many people that go into nursing have aspirations to go, be a chief nursing officer or educator or all the way up to the ranks of, potentially even being in the C-suite and running a hospital or a
Hmm.
hospital system. I know there's a hospital local to me that the CEO is a former nurse. And it's like, okay, they've seen everything, and they've done quite well in the role that they're doing. But having said that, I'm sure there's still a lot of attrition there. But uh, what I want to get to though is you walked away from this. When you
Hmm.
first decided, I want to be a nurse, and you were successful at it because that's how you got into leadership because you were successful at being
Hmm.
a nurse, and you walked away from it. And what was that? inner dialogue like for you? Because I think a lot of people right now, and obviously for the past few years anyway, are thinking about that. It doesn't matter if they're a nurse or they could be in any role, where they're
Hmm.
like, you know what, this mountain that I climbed, that I wanted to, I put all the time and effort and things like that. I've decided I don't want to be on this mountain anymore. What was that like for you?
Mm. Well, I found myself being very stuck, not sure where I wanted to go. Like was, eh, I loved the person that I worked for, my direct manager. I loved her. I loved our leadership team. Like we had such a great team, but I couldn't do it anymore. And it was a real struggle for like, um, a year. And actually, there's a funny story, Michael. I was listening to a lot of like, I don't know, self-help podcasts or, you know, like personal work sort of podcasts. And there was a guy that I followed who said, you should, if you want to like be true to your word, let's say you want to quit your job, tell your friend, that you'll give them $1,000 in a week if you don't quit. Because I knew in my heart, like I needed to quit. I needed to quit. I needed to have that conversation, that difficult conversation. And I didn't know how people would see me stepping down from that role. I still was nursing, but I was a leader on the unit and I was just feeling like I couldn't let people down, that my desires weren't as important as this. And I was a cog in the wheel, you know, truly. So I don't know. Eventually, I did that. I had a conversation with a friend and I was like, listen, I'm gonna, you need to keep me accountable here because I have to leave. So I did have the conversation and that's okay. Like I was sad and the person I worked for was incredibly sad and there were lots of tears, but it was like a break for my freedom, which sounds really dramatic. But like I had aspirations of like, let's try, like I tried, I did like all the avenues that I could as an ICU nurse. I was like, let's try this, let's do this, let's do this in advance, in advance, in advance, in advance. And then I just got to a place where I was like, I can't, I'm done with that. And now what do I want to do? And I found that I wanted to start a business and I wanted to help the helpers, you know? So, but it was a really difficult time for me. I probably stayed about a year longer than I should have.
It it's hard to pull, that or push that button to say eject, even when you know it's the right thing to do. And you could talk with your friend, and kudos to your friend for agreeing to hold you accountable. They probably would have anyway.
Yeah, they would
No,
have.
good friends do that. They call you out on your BS real quick.
Mm,
They're and sometimes we're really thankful for that, and other times maybe not so much. But yeah, that when you know it's the right thing to do, yeah, that's where self doubt comes into play. And of course, when you're burned out and you're fatigued, your cognitive abilities are struggling to say the least, and you're not resting, you're not feeling well. So you're thinking, okay, am I making this decision based on me being burned out, or scale that back and just kind of look at everything else is perfect? Yeah, I'm in a utopian place right now. Should I quit? And you knew, for a year that yes, it wasn't right for you. And I have a cousin of mine that worked for a government agency. I won't name it, but it rhymes with the U.S. Post Office. Anywho, he was a carrier for years. Finally, had an opportunity to get promoted into a management role. He was in that role for a while and literally hated every second of it. Couldn't stand it. Just because the nuances of all it does and requires in that type of role.
hmm.
So he left and he went back to going outside, delivering the mail and all the nasty weather because it was in the Midwest. So we get a bunch of seasons and sometimes we get them all in the same day. But for him, he'd wanted to do that his whole time, his whole life. He's
Hmm.
like, get there, and you get. And I use this analogy because in my career, I was originally a public accountant, did the accounting school thing, worked for the CPA firm, did the tax season. April 15th for my friends in America, and for my and for and April 30th for my friends in Canada. But then my colleagues or former colleagues in the tax industry, tomorrow's April 16th. You can go outside again and hear the birds. It's fun. It's great. But anyway, so I did that. And that was my career. That's what I wanted to do ever since I was in eighth grade. And I got to it. I was in the role, successful, things like that. And I went, I don't want to do this. And my parents were like, what? What do you mean you don't want to do this? This is what you want to do your entire life. I don't want to do this. So I
Mm.
went into IT. And then I did other things, and then I do other things. And I've been fortunate to be able to do a lot of things. And I've enjoyed all those little twists and turns. Why? Because you get to be creative. And I
Hmm.
think that's not that you can't be creative in nursing. You definitely can. I mean, there's
Hmm.
obviously regulations and rules and whatnot. But for you to make that decision and go, you know what? I see a need here, and that need is not being fulfilled, like you said, anywhere, which is so upsetting to me, because, like, come on, this is so important. Our nursing profession needs help, and there was nothing out there. So you decided, well, there will be now, and
Hmm.
you scratched that itch and you went, I want to run my own business. I want to go out on my own. I want to do something. No safety net other than whatever methods you had to keep
Hmm.
yourself fed and clothed and housed. But you went and did this, and now tell us more about that, because what I've learned about it, it's absolutely amazing what you do, and the impact and the change that you cause for our nursing profession is immense, to say the least. So I want to share a little bit about the retreats and what they're like, and some of the feedback you get from all the people that have partook in all the fun and adventures you have in these.
Well, there's just, by the way, so much of what you said is true about that hospitals could be doing more, and especially like it is, or that there's not as much out there, and like they're trying to throw things at the nursing profession, some, to try to helping with like nurse well-being, and but they're it's astounding actually after being so the pandemic was just like really it ended like 4 years ago. So um my retreats are so fun, I will tell you. I love them. I love planning them. I currently am doing retreats in Mexico, Morocco, and Bali. And I like as so nurses, right? Most of us are caregivers. We're nurturers. We're like just continue to give. So I like to have my retreats focused so you can just show up and be cared for. You don't have to worry about anything. I have the itinerary. I'll get you at the airport. And essentially, I have an itinerary that people can do whatever they want, or they can do all of it, they can do none of it. So, really, it's about offering different modalities for stress reduction. So, we practice those like meditation and yoga, journaling. Um, we do like I provide continuing education to the nurses. I don't want to give them too many hours because that's not what they're there for, right? I give them education on different stress reduction modalities, evidence-based stress reduction modalities, and then I provide downtime and rest in really beautiful locations. I also try to incorporate cultural components wherever we are so people can feel revitalized about learning about different parts of the world. There's something that happens truly magical, and I probably should do research into what it is. But when you travel, you get outside of your normal life, you get a chance to reflect on what you like about your life, what you don't like about your life. And so there's this like embedded thing that happens in the retreat where there's self-reflection about maybe I don't like how my life is right now, or maybe I want to change it somehow. But yeah, so that's kind of the program. Like, let's say you wake up, do yoga, do meditation, have breakfast, learn for a couple hours, maybe two tops, and then you're on your own for a while, and then we'll like reconverge for dinner, a group dinner, and like a reflective practice at night. So that's kind of like a day. So, um, the nurses love it. The ones that have gone have absolutely loved it. They love showing up and not having to worry about a thing. They like having their meals made for them. They like having the ability to just be taken care of. And the nice thing about offering continuing education is some hospitals will be reimbursed for that continuing ed time. So that's really, really really important for the nurses to be able to feel like they're affordable and they're getting some subsidy in coming.
Yeah, it gives them, it ties it together. But I love the format about, okay, we're gonna spend a little bit of time going over, whatever, training session you have. And then you have this, pretty big block of, eh, do whatever you want. You're in Bali. What do you want to do? I mean, here's some ideas. Here's some things
Oh,
if you'd like,
my dog.
but I have a
Sorry.
dog too. No, 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 no. I have a dog too. I'm actually surprised he's not barking, but he's tired today, so he's keeping quiet so far. We'll see. No worries. No, I love the furry friends.
Yeah,
I've had many dogs on the show. Actually, they weren't on the show, but they were on the show basically, and I do an interview and like clockwork, the UPS driver would show up and the dog barks
that's
at
what
the
it
UPS
is.
driver.
It's the
Yep.
UPS driver.
Yeah, there's something, I don't know what it is, but yeah, they usually go crazy for the brown truck for some reason.
Hmm.
Maybe they're just thinking they're finally getting their order of treats that they've been
Yeah.
asking for forever. I'm not sure which. But
Yeah.
going back to that middle of the day kind of flexibility. For nurses, I mean, there's so much prep work and to just go and be. That's all you have to do. You don't have, like you said, you don't have to do anything. You can go to the retreat. You can just hang out in a cabana or wherever you happen to be, and not attend a single session and go back and okay, cool. But there's the whole idea of this is to okay, how do we teach our nursing profession on how to basically be a caregiver for themselves? And that's we know this, in nursing, motherhood, all of that, you put everybody else before you. That's just what we do. And you got to take care of yourself first. And that sometimes isn't intuitive for people because they've never given themselves the permission or felt that they had the permission to do so. But when you do, then you are presenting a much better version of you, a healthier
Hmm.
version of you, and learning the techniques and things that you go over. And every retreat is different. That's the beauty of it too,
Hmm.
because they're not this cut and paste kind of thing where if you go to one, you've been to all of them. Where it's like,
Hmm.
no, we're gonna tweak some things, and I'm guessing too, you probably adjust a little bit on the fly just based on who's there and what they're talking about. And I think that's the beauty of having this creative component that you do with these is okay, we're sensing this. Well, let's talk about that. Let's do some things in that. Let's do an exercise about that. And all of a sudden they go, wow, this is so different than any other conference or retreat that I've ever gone to before. And
Hmm.
they go back but home and they literally are changed. And I'm sure people around them go, where did you go? We need to go. Yeah, yeah, yes, you do. And it's important to, be for all the nurses that are watching or listening to this. I'm sure to have links in the show notes so you can, sign up for a future one because I know it'll make a huge difference in their lives. But what what's some of the feedback you get from the nurses that have attended that you can
Mm,
share? Yeah,
well,
go ahead.
one in particular was like, I can't keep living my life this way. I can't keep living my life this way. So she made it so she cut down her hours at work so you can reduce your like FTE full-time employment. So she reduced her hours at work and she is a mom, has 4 kids, um, a husband who also works a lot, but you know how it is with women and I'm not trying to put shade out there to any guys, but like women do can do the lion's share of the work in the household. So she took a break and was able to like take care of herself, and it was directly correlated to after a retreat that we went on. And that made, I mean, that's so cool. It's the self, well, there's kind of two things. Like there's a community experience with to have a shared experience with people who have also like a shared work experience. And nursing is so unique. And we see, what we experience. It's really nice to be around people who inherently understand the work in and of itself. And then to have that time for self-reflection um, is invaluable. And some people that come are like, I've been wanting to go for a long time, and I felt like I couldn't come. I wouldn't, for whatever reason, I wasn't allowed to go because then I would be away from my family or whatever. Not allowed like permission, but you know what I'm trying to say. Just like too much to do, and why should they invest in themselves? But they just have such a great time. And then again, that this time for self-reflection and change afterwards. So, and I've had repeat clients and which is always fun. It's pretty incredible to be like, you're gonna go, you want to come again? Like, um, but yeah, and some people, oh, one really cool thing is an attendee who came, she's like starting a nurse retreat for her unit, which I think is the biggest compliment to me. Um, that, yeah, I mean, this is not proprietary. This is not a proprietary idea. You can, I went and learned about, I took some certification classes. I learned about stress reduction modalities, came up with a program. It's not like anybody could do it if they really wanted to. So, the fact that she's doing it and offering it to her community, is super cool.
Yeah, it's spreading the word and creating disciples or minions, depending on how you want to call it. I tend to lean towards the minions just because I'm
Yeah.
sarcastic, but it's like, yeah, do this. And okay, maybe your team can't afford to go to Bali or, the Riviera, wherever, but you know what? There's plenty of places in every state or every province or every
Hmm.
country that's within driving distance, and you can spend a day there or a couple days there and just literally focus on you and
Yeah.
get away from the laundry and the chores, and running a household is a full-time job in itself. And as a guy, I yell at guys all the time and say, look, if your partner or spouse is working full-time and you're working full-time, divvy things up. And I'm calling out every dude out there that thinks otherwise. It's 2026, kids. Come on, be real
Yeah.
about this. My dad helped. He worked full time. Mom did and didn't, but even during the times that she wasn't working as much, dad helped, and was, anything that he could do. Um, and he got up
Yeah.
early and worked an early shift, but he showed up. I, I do the same thing in my household. Why? I like a clean house. I don't know. Maybe it's just me, but it just makes it easier. It's a partnership, and when
Yes. Yes.
people come back from your retreats, yeah, I'm sure there's some, I don't call them day of reckoning conversations, but maybe some conversations that, those tough conversations when they get back home or get back to work and say, okay. And again, there may be some situations where you have some nurses that go, done the reflection. I've learned a lot about myself and realized, like you did, maybe this isn't the right thing for me anymore.
Hmm.
And give yourself permission to make that judgment call and decision, and do what you need to do to take care of yourself. And I think when you do that, the world benefits from that. Yes, we all need nurses, but you know what? We need everybody to be the best version of themselves, whatever
Hmm.
that looks like.
Hmm. Yeah. I
So,
do want to say
but
that
go ahead.
if there aren't any nurses that are listening out there, it's not your fault if you're burnt out. You're working in a system that the majority of the reasons why people are burnt out, it's their environmental factors. So I just want to say, like, wherever you are, talk to your organization about looking up the healthy work environment tenets from the American Association of Critical Care because they tout like safe staffing, authentic leadership, meaningful recognition, true collaboration. I forget the other two. But like, and if you, I mean, there is room for working on yourself and learning how to practice like meditation and mindfulness and breathing exercises and gratitude and self-compassion and learning boundaries and all this stuff. But there's a lot of stuff that your hospital can do and should do. And when I think there's new research out that shows if hospitals are employing the healthy work environment standards, that they have safer hospitals, which is better for everybody. And so, anyway, yeah, back to you though. It's not your fault. And so, just want to offer, just acknowledge that. So,
No, and I'm glad that you did, because a lot of times when people are stressed or burned out, they blame themselves. Well, I did this, and no, not really. You did a whole lot and went up against this big hill, and no, it's taken a toll on you. So now let's do something to correct that. So
mhm.
love this conversation, Nicole. Where can people find out more about you, your retreats, and everything else you're doing?
You can go to unwoundretreats.com. Also, I'm Unwound Retreats for Nurses on Instagram, and just to make it difficult, NicoleJohnson.rn on TikTok.
There you go.
But
I'll definitely have that in the show notes. So, Nicole, thank you for being you. Thank you for being brave and bold, and taking this step to do something to help our nurses, helps yourself, of course, because you have healed from your own burnout journey. You've seen the signs, and you can help others avoid it or recover from it, and we need a lot more people like you to do that. So thanks again for being on the show. Really appreciate you.
thank you so much for having me. I really appreciate you.